Welcome to the Roetzel Health Law HotSpot. Health Law HotSpot is a podcast for physicians and health professionals that covers the legal issues and trends that affect the healthcare industry.
Hi, everyone. Welcome to the Health Law Hotspot. Today, we have an amazing topic. We're going to talk about financial planning for healthcare professionals from the start of your career through the end. I have two great guests with us, and I'm going to go ahead and make some introductions. First of all, I'm Ericka Adler. I'm a shareholder at Roetzel Andrus, and I run our healthcare practice. Today, I'm joined by Brady Petersen and Jake Whipp. And let me tell you a little bit about each of them. And I've worked with them both for many years now. Brady works at Larson Financial since 2011, and he provides financial expertise for physicians across the country, pretty much. He holds the following designations: Series 7, Series 65, Series 63, as well as life and health insurance designations. Brady uses his financial experience from handling managed investment account, operational analysis, to exchange traded fund sales, to provide concierge level services for his clients. He really provides complete financial services and stability for his clients that allows them to really concentrate on their demanding schedules. Jake as well has been with Larson even longer, since 2008. He has the following registrations: life and health insurance licenses, Series 7 and Series 66. Jake works primarily with physicians to help them protect and accumulate wealth, which is especially important because his wife, Amy, is a physician, and I'm sure we'll hear about that. And Jake and I have worked together for many years in trying to help doctors really think about the things they should think about throughout their entire career, and protecting all their hard work and their investments. So we're really happy to have both Jake and Brady with us. And I'm excited to have you here largely because we've worked together a lot with physicians at different stages, a lot of residents and fellows, some of them kind of in the middle of their career. They might be switching jobs. They might be becoming a partner in a practice, or they might be selling out or retiring. So really, with the two of you, I've kind of been through that entire range. And I'm really interested in hearing from you a little bit about how you handle your clients from start to finish in terms of the different stages of their career, what they should be thinking about, what are some of the pieces of advice you offer, and maybe what are some of the things to avoid as well.
Yeah, so basically, Ericka, thanks for having Jake and I on. My name is Brady Petersen with Larson Financial Group. And oftentimes with the earlier, younger physicians, finishing the residency fellowship, it's exciting, it's cool. It's a big responsibility though, because they go from making $60,000 per month, potentially up to $500,000, or $60,000 per year, up to $500,000 a year. I mean, that's a huge increase, and it's a lot more responsibility. And it's easy to get that first paycheck and be excited when you're actually in practice and feel like, oh my goodness, look how much money I'm making on a monthly basis. And then immediately feel a sense of anger when you see how much taxes are taken out. You're like, how is this even possible? This is straight up robbery, etc. So it's crazy when you talk to clients, when we talk to clients, and we hear that kind of emotion. So it's a big responsibility with the income jumping up. And oftentimes life gets so busy, especially starting practice, joining a new private surgery group, etc., starting at the new hospital. It becomes stressful. It's a lot of work. It's a lot to get used to. And so, but it's really important at that same time to really pay attention to what's going on from the financial aspect. Jake and I both met physicians in different parts of their careers where you think that they should be a lot further ahead than they are. And a lot of times it's just that they just ignore it. There can be the idea that, hey, I'm making a lot of money, I can worry about this later. But the building blocks start early on, even in residency fellowship, and then maintaining good principles when you hit practice, and then experiencing that higher income is really, really important to pay attention to. So, and also bringing in proper professionals into your life to help you throughout that process. Obviously, Ericka, you've built a practice as well off of working with physicians a lot for medical contracts, and oftentimes it's so busy they need extra help in terms of doing it right and doing it well from the beginning. So Jake and I have done a lot of that over the years. It's quite great to see when a client starts off, when their negative worth or when their net worth is a negative $300,000, and a few years
Right.
later, they're hitting $1 million net worth. And they're like, how did that happen? And it's
Right.
really just starting with the principles of getting focused early. So oftentimes when you see that big number on a contract, it's important to say, okay, I'm making $400,000, 500 grand per year, to recognize that it's still a limited resource, meaning that you can make 40,000 per year or 4 million per year. But if you have no idea the dollars in, dollars out, that's where people really start losing control and don't get to where they want to be. Ultimately, the idea is to have the story end well, meaning that you finish your career, you're set up, you can give back to your kids, set up your next generations. Because physicians, when you think about it, they have a very interesting career time span. Excuse me. Go through medical school, accumulate a lot of debt. They don't start hitting their first quote unquote real professional, in practice salary until usually their mid-30s. So by that point, they have a ton of debt to pay off. They make good money. They have the tax problem, but they also have a shortened retirement window to save for the future. So, it's a shortened time span. So navigating all that can be tricky. So one of the things, it could be as simple as, what is the cash flow going to look like? How are we going to break this down? Let's have a good estimation on the budget. Disability insurance is important because if you can't operate, this all goes out the window. If you can't operate and you've bought $1 million house, you have $200,000 of debt, you have all these goals, everything riding, and you can't operate, well, you need to cover it with the right type of disability insurance. That's one small aspect. But even something as simple as debt repayment, rates are extremely low right now. So how do we figure out what term to use? Is it 5, 7, 10 year? I don't have that answer. It depends on the client, depends on what their relationship is with money. How do they feel about it? How do they feel about debt? But ultimately, what does this mean for future? If you work to pay off all your debt up front and you're paying a 3% interest rate, well, you're missing out on the market returns as well. The arbitrage of investing potentially in an 8% return in the market long term puts you in a better spot in the end. And Jake will go into that more later, but that's really an important part that people lose aspect of. They have no game plan. So having a coordination from the beginning to the end on all aspects is really something that's vital from the very beginning. Something is a home. You purchase a home, you spend way too much, and then all of a sudden, you want to furnish it. It's a year and a half, 18 months later after you purchase the thing before you can even have an extra penny to spend. And it's just because you overdid it too early. So all things to consider, and every personality is different, every situation is different. So having knowledge, having some recommendations, and knowing the hypothetical situations that what your decision can lead to is important. A, B, or C, what are the scenarios? I like option B. Okay, well, that's at age 60 retirement. That's what we can reasonably, hypothetically estimate that you'll be able to spend X amount of dollars at that point and build in other costs along the way. So to get there is vitally important, but looking at the cash flow, when you have extra dollars per month, how do you save it efficiently? You have 401ks, retirement plans, Roth IRAs, not qualified accounts, other options. How fancy do you get? How much risk do you take? How do you be as efficient as you can from a tax perspective? You don't want to leave money on the table. You don't want to miss opportunities. And oftentimes when people get so busy, that's where they miss opportunities. And they're like, oh, I should have done this earlier. Or why didn't I do this earlier? There's one physician.
Do you think young doctors are open to these conversations, or do you feel like, they are just so happy to have a paycheck that they figure they'll worry about it later?
I think a lot. There's definitely some that are really on top of things and really dig into the details. Maybe they have a family member in finance who guides them. Sometimes they're just, hey, I'll worry about that later. And they kick it down the line. Yeah, that all sounds good. They recognize that they need it or they should have some help, but I'll get to it later. It's easy to put off.
I find I like to send people to you guys when I see that they are, let's say they're married and they have a spouse and maybe they're having kids, because they're getting a paycheck, but they're not really thinking if they die or become disabled about how that family gets taken care of. So then, and then asset protection is important. I mean, I have some docs, I mean, maybe they're brain surgeons, maybe they're making $700,000 a year, but guess what? They're also likely to get sued for that
Right.
kind of surgery as well. And a lot of them are, not thinking about what their exposure could be on the house they buy or their accounts they set up. So do you guys also kind of talk with doctors about like kind of how to protect their assets in that kind of situation as well?
Yeah, we'll talk about it for sure. I mean, if assets are open, we need to identify that and bring it to their attention. We're not attorneys, so that's where
Right.
an attorney will have to come in and make that final recommendation. But obviously, it can depend on a state, um, you know, joint tenants by or with rights of survivorship versus tenants by entirety. There's different states that have different options, community property. You'd be surprised of how many just don't even have wills or guardianship set up, and they've got 3 kids, and they're like, "Oh, I got to figure that out." And it
Right.
sounds so basic, but again, they're so busy. It's tough for them to remember. So
Right.
you just have to kind of push them along to get to that point where it gets set up.
I think some doctors that I see also they're getting recruited to areas. They have a lot of money, or they're getting signing bonuses that have to be paid back if
Mhm.
they leave. From a lawyer perspective, I try and say, you know what, you're not going to owe that money back, or you shouldn't owe the money back unless you're the one that walks away, or you do something bad. But a lot of times, hospitals won't negotiate and groups won't negotiate. So if your relationship ends, and it could be death or disability, they still have a right to come after you for that money as well. So a lot of, in terms of your money being at risk in ways you didn't anticipate, it's that as well. So I mean, life insurance to cover those debts that you owe back is something I know I talk about with doctors a lot too. And these days I'm seeing really huge signing bonuses and recruitment amounts, and the possibility that a doctor is going to have to pay that back is pretty high, because they are unwilling typically to carve out the reasons, that you have to, you leave, you pay it back. And we used to see a lot more, like, depending on when you left, you would prorate the amount that was owed back, but now it's like you leave, you owe it all back, and you owe
Right. Right.
or something like that, right?
Yeah.
So I mean, I don't know, are you seeing any of that? And
Well, yeah, obviously from the very beginning. I mean, when you start a job, you want to make sure hopefully it's the right job from the beginning and you're not getting, taken advantage of or tricked. And the group is who they say they are. And you kind of, full focus of what's happening. Um, I've seen clients, thankfully, I haven't had too many leave within that time where they owe money back. I had clients owe money back, but it hasn't been insurmountable. Oftentimes, a key part is to have that emergency reserve set up, the free cash established very early on to, if this happens, you can tap into it. Oftentimes, I've seen clients, especially with the partnership comes around, they don't know the details. And then when it happens, then they're like, oh, I guess I'll figure out the buy-in at that point. And then they're trying to figure out this bank loan to try to get a huge, the money to buy in, or they're not sure what that looks like. And then partnership obviously brings in a lot of opportunity, but they're not sure how to get, what that's going to look like. So forward thinking, just prepare for that, and asking the right questions is key, as well. So the partnership as well, when you're in a surgery center, you get opportunities for buying into the surgery center. If you're getting a partnership, a K1 income, for example, that's extra income coming through. Understand the taxes, understand are there opportunities to help offset this K1 income, help reduce your taxation, your tax burden, especially for the high income earners. It's great, but the taxable burden is absolutely huge. Is there other opportunities for, and understanding what these are is key. So if you work with someone, you want to know the capacity of what's available to you. So surgeon partner at a practice, looking at it and say, okay, we can do a cash balance plan. We can set that up and defer another $100,000 of pre-tax income and lower your taxable income each year. Is that available? Well, let's look into it. If you have the K1 income, is there stuff to produce, another option to produce a negative K1 to offset that? Are you maxing out everything that's available to you? So that's all key stuff. When it comes to paying back loans or, a bonus, that's obviously changing. It depends on the group, just as you've seen, but it's key to prepare for that and ask that question up front and just tell the client, listen, if you leave early, this is what you owe back. And usually if they're a resident fellow and this is their first job, they're like, oh, wow, that's a lot, so maybe it sends off kind of some warning signals for them.
Right.
So but it's a great job. It's a great career path. It's just a lot of responsibility. And then transitioning over kind of the once you're already established, Jake works with a lot of physicians and bring it to that point where they're going to retire, that's a key part as well. And Jake, why don't you elaborate a little bit on that aspect of the physician career?
Sure. Yeah. So I'm really passionate, obviously, about helping physicians, dentists, business owners, things like that. But with respect to doctors and dentists, I would say, generally speaking, people hire me for two reasons. One is to set up a financial plan, and the other is to actually implement the financial plan, be it investments, insurance, and those types of things. I think what has caught more physician attention since really COVID is the financial plan. I work with a number of anesthesiologists in Chicago, and there's a few that call it the scorecard or my report card. I want to see my report card. And the importance of the financial plan is really going back to a source of truth that will allow us to see when the market is high, when the market is low, when things are shifting, like today. Dow's down over 500 points. So on a day like today, it's are we on pace for our goals or not? So if you're using your measurement of just return, that's really going to put you on a cycle of saying, like, gosh, one day you're going to be able to walk away 5 years earlier, and then the next day you're like, no, I'm going to die at work. So when we develop a financial plan, we use 3 different probability models. And I know that this probably sounds boring or beige, but this is really the important piece. And this is the piece I get passionate about, because this is the piece that tells people, how are you actually doing? So we use an average return method, which just simply means if you got the average return for the risk you're taking, are you on pace? We use another one that's called a bad timing method. And this has probably become my favorite one. Might not be the most accurate, but it answers the question of, okay, knock on wood, seems like we're getting through this pandemic. Gosh, what if another one hits? What if another one happens when I'm in retirement or nearing retirement? Do I have sustainable wealth, or am I going back to work? So that we get to say, we've been planning for this all along. So a bad timing measurement means you get to retirement and 2 consecutive really bad years happen in the market. And then we take it through another 1,000 simulations of what's actually happened in the market dating back till 1927. So we can tell our clients with absolute certainty, look, here's how much you need to save, here's where you need to save it, here's how to be tax efficient. And if you follow this, you'll know how the story ends, as Brady said. And what's really cool, and this is probably my different definition of cool, I think this is cool, other people probably don't, but I think this is fun. So we actually take the investment side of what you're actually doing in your 401ks, 403bs, 457s, those types of things. Side note, we help our clients manage that as well. A lot of people and a lot of advisors don't or can't, we do. So we can actually link up all their Roth IRAs, brokerage accounts, 403bs, all that to their financial plan. And then every 90 days, I offer my clients a meeting every 90 days to say, how are we doing? So what we're doing on the actual implementation and investment side informs the financial plan. And we get to say, it's okay. You're fine. If you freak out, may it not be about this, may it be about something else. Right. So that's really fun to talk about. Other elements for in-practice physicians, or even physicians in retirement. I assist physicians in retirement as well. Really talking about whether it's 401ks have been a hot topic lately. I've gotten a lot of inquiry about 401ks. There's so many hidden fees and all those types of things. I was actually in Iowa a number of years ago looking at a 401k plan. And again, these are the hidden costs, hidden fees that doctors are like, someone else handles that. But this is really important. So looking at a 401k plan, you want a flat fee pricing model. Other clients have had asset-based pricing models when it comes to record keepers or TPAs, all the legalese that keeps the plan running and keeps it compliant. So essentially, we saved a 401k plan $60,000 a year just by moving to a flat fee pricing model. just by doing that. Things like Roth 401k plans. As an advisor, I want to have the highest level of fiduciary responsibility, which takes the risk off of all of the busy physicians and puts it on an advisor. That allows them to step into what they're doing well, whether it's a surgical procedure or whatever it may be, meeting with their patients and saying, I know that someone has my back in this. And that's exactly what we do. A lot of other, I mean, this isn't the platform necessarily to talk about the intricacies of investments and those types of things, but we do a lot of low cost academic based investing. As our physicians practice evidence-based medicine, we practice evidence-based investing. And that's what we do. We do it really well. And on top of that, we have a lot of our clients also lately, I think with just market volatility and fluctuation.
So would you say then, like, so if we break it down, I mean, I think this is all really great information, but, you know, if you're at different stages of your career, you know, when you're young, obviously you have those first discussions, you know, should I put money away? Can I afford to? What does my budget look like? You know, do I need to save? I got to pay back my loans. I've maybe got to pay back a signing bonus. So you got to kind of think about those things. I might need life insurance, disability insurance. I've got a family. And then as they go through their career, they're thinking, oh, I want to buy a house now. I want to have a kid that's going to go to college. So their needs over time. And then they start eventually thinking maybe about partnership and then, you know, retirement. Right. So, you know, in terms of their progression, you know, do you, I mean, do you kind of, I assume you grow with your clients, there's new opportunities, new products, and new concerns over time. So do you generally work with your clients kind of right from the beginning of their careers to the end? Do you kind of find yourself, you know, kind of working with doctors who waited too long to kind of think about what they need to do? Or, you know, generally, what are doctors doing? What are you seeing out there?
You know, that's an interesting question. I've certainly worked with a lot of physicians from residency through their careers. Done a lot of that. I think with all the intelligence, there's a lot more intelligence online around physician finances. So I might be introduced to someone mid-career. I think it really varies. I don't know if there's one versus the other. I think it's one. I always get so excited anytime a younger physician is really taking it seriously, wanting to have a conversation and really avoiding those pitfalls. It's really, really fun to help people plan from the onset and say, look how far we've come. This is amazing. I was talking with a surgeon in Colorado yesterday, and I was saying, look, you guys are in your early 30s. We're implementing a savings plan. We've done some of the debt stuff. We've done some of the disability stuff, but think about this. You're starting to save and you're on pace for your retirement in your 30s. How amazing is that? Right. That's wonderful. So yeah, so I don't know if there's a particular more versus the other, but I think with all of the intelligence that's out there around physician finances, I think what doctors are seeing is, I know my limitations. There's value in specialization, and I need some assistance. I know I can do the budgeting, and I know I can get, you know, I can kind of do day-to-day finances, but really to get where I want to be, right, I need a specialist in my life, and that's who we are. So that's the really fun part. But yeah, and you know, there's a lot of, you know, when you talk about designing the plan and things like that, as Brady mentioned, we'll go through a financial plan, and we'll even model it out for them and say, if you want to pay off your debt right away or like in 5 years, how much further does that set you back? Do you have to work extra? So we'll model all of those things out. But yeah, it's equally as exciting to meet someone kind of mid-career. I was working with a physician in Chicago, oddly enough, recently. I keep mentioning Chicago, even though my client's all over. But the examples are just more Chicago-based, I guess.
Right.
So this person was saying, this is an in-practice doctor. This person was saying, my mortgage stresses me out. I need to refinance. It even took so much bravery for this couple to say, this has just been the thing we just pushed to the side, and now we're just so afraid to look and be like, how bad is it? Like, let's peek. Okay. And actually, it wasn't that bad. It was amazing. So we helped them refinance their mortgage. I helped them with some student loan stuff, but really it was designing the plan, planning for education, and they're on pace for their goals. It took about 90 days to do work. And now this person who was terrified of their financial side of things Now they're in a position of, it went from a position of weakness to a position of strength and a point of like, we did it and we're doing it really well. So that's really fun.
Right.
Yeah.
All right. Well, I think that's been super helpful. And why don't we have to wrap up in just a couple minutes here. So, any last thoughts on kind of big picture piece of advice that you'd want to share with doctors who are, not quite doing what they should be doing after hearing you talk?
Yeah, one thing I would point out is that money can be a highly emotional topic. And you don't want to ignore the emotional component of it. So from our point of view, it's important to walk through, have a client understand what they're doing, and the big reason is why they're doing it. And if we can work through that with the clients, and just as Shake said, he just gave an example of reducing stress. That's a key part as well. And it's really cool to go through that process when a client is a little apprehensive, they're not sure what's going on. And then by the end, especially after a few years that they've seen the process, and emotionally they're feeling much better. So not ignoring the emotional component is a big item as well.
Great. Jake,
Yeah.
any last thoughts?
Yeah, I think that, getting started early is a good thing, obviously. I was talking with a physician in Wisconsin today, and this physician was essentially saying, like, when should I get an advisor? I think starting as early as possible and developing that relationship, because look, when you're in practice and you have $1 million, every advisor is going to want to work with you and this and that, but developing that lifelong relationship, and I think it is a unique relationship, really, there's something to that. The other thing that I would say with physicians, what I've seen is everyone kind of follows the leader. So my encouragement to physicians is always be yourself. I might not be the right fit for you. You might be a do-it-yourselfer, but don't be a do-it-yourselfer just because your friend or your colleague who you respect greatly is a do-it-yourselfer. It's okay. It is okay. It is okay to be you and to hire that out. If you need that area of specialization in your life, do that. That will be very life-giving to you, rather than to sit here and be like, oh, I have to do this again. And I'm really doing it because Dr. So-and-so does it. And I feel like I'm wrong by hiring someone. Right. Be yourself, lean into who you are in this area, and make the best decision for you and your family, whether that's me, Brady, somebody else, or even themselves.
I absolutely agree. And I think financial planners play a really important role. When I look at contracts or talk to partners who are buying into a surgery center or buying into a practice, I'm always like, have you spoken to your financial planner? I mean, a lawyer plays a role, but that role is somewhat limited. I can't tell you if the employer's offering good health insurance, life insurance, disability insurance. I don't know if you're ready, if you can afford the deal that you're about to do. So really feel like, working as partners with financial planners like you guys is really a tremendous service to doctors all around. All right. Well, thank you so much for joining us. We're a little bit out of time now, so I'm going to say goodbye. And thank you so much for joining us. And we'll see you next time on the Health Law Hotspot. Thanks so much.
Thank you.
Use of the Roetzel Health Law HotSpot does not create an attorney-client relationship between you and the firm or any of its attorneys. The Roetzel Health Law HotSpot should not be used as a substitute for competent legal advice, and you should contact an attorney in your state about any legal needs or questions you may have.